Hey everyone, welcome back to Healthy Mind and Body. Today, we're diving deep into the world of thyroid health. Now, the thyroid, it's a tiny gland in your neck, but it plays a huge role in your overall health. And unfortunately, millions of people suffer from thyroid problems without even realizing it. We're going to cover everything you need to know, from the common symptoms that might indicate a thyroid issue to natural remedies that can help support your thyroid function. We'll even talk about who's most at risk and how thyroid problems are diagnosed. Just remember, this video is for informational purposes only. It's not a substitute for professional medical advice. If you have any concerns about your health, always reach out to your doctor. So, how do you know if your thyroid might be acting up? Well, the tricky thing is, thyroid problems often masquerade as other issues. You might think you're just stressed or overworked, but those nagging symptoms could be your thyroid sending out an SOS. One of the most common signs of a thyroid imbalance is feeling exhausted all the time, even after a good night's sleep. You might wake up feeling like you need to hit the snooze button a dozen times. And it's not just about feeling tired, it's about lacking that get up and go energy. Another telltale sign is unexplained weight fluctuations. Have you noticed the numbers on the scale creeping up or down without any major changes to your diet or exercise routine? That could be your thyroid throwing your metabolism out of whack. And then there are the mood swings. Thyroid hormones play a role in regulating your mood, so it's not uncommon to experience increased irritability, anxiety, or even bouts of depression if your thyroid is out of balance. You might find yourself feeling more on edge than usual or having sudden emotional outbursts. Other symptoms to watch out for include changes in your hair and skin. Hypothyroidism, which is when your thyroid is underactive, can lead to dry, brittle hair and nails. You might also notice that your skin feels rougher or drier than usual. Digestive issues are another common complaint. Constipation is often linked to hypothyroidism, while hyperthyroidism, an overactive thyroid, can cause more frequent bowel movements or even diarrhea. Some people also experience changes in their menstrual cycle if they have a thyroid problem. Irregular periods, heavier or lighter flow than usual. These can all be signs that something's not quite right with your thyroid. Temperature sensitivity is another clue. Do you find yourself feeling constantly cold even when others are comfortable? That could be a sign of hypothyroidism. On the other hand, if you're always feeling hot and sweaty, it could point to hyperthyroidism. And keep an eye out for any swelling in your neck, especially around the area of your thyroid gland. A goiter, which is an enlarged thyroid gland, can cause noticeable swelling in the front of your neck. Lastly, pay attention to your heart rate. An overactive thyroid can lead to a rapid or irregular heartbeat, while an underactive thyroid might cause your heart rate to slow down. Here's the thing about thyroid problems. They don't discriminate. They can affect anyone, regardless of age, gender, or ethnicity. But there are certain groups that are more susceptible to developing thyroid issues. Women, for instance, are far more likely to experience thyroid problems than men. In fact, it's estimated that 1 in 8 women will develop a thyroid disorder in her lifetime. This is partly due to the hormonal changes that women go through during puberty, pregnancy, and menopause. Speaking of pregnancy, it's a time when thyroid health is particularly crucial. The baby relies on the mother's thyroid hormones for proper development, especially during the first trimester. So it's essential for pregnant women to get their thyroid levels checked and monitored throughout their pregnancy. Age is another factor. As we get older, our risk of developing thyroid problems increases. This is especially true for women over the age of 60. Family history plays a role as well. If you have a close relative, like a parent or sibling, with a history of thyroid disease, you're at a higher risk of developing one yourself. This suggests that there may be a genetic component to thyroid disorders. Certain autoimmune diseases, such as type 1 diabetes and rheumatoid arthritis, can also increase your likelihood of developing thyroid problems. This is because these conditions cause your immune system to mistakenly attack healthy tissues in your body, including your thyroid gland. Exposure to environmental toxins such as radiation and certain chemicals has also been linked to an increased risk of thyroid cancer. So, it's important to be mindful of your exposure to these substances. Certain medications, like lithium and amiodarone, can interfere with thyroid function and increase your risk of developing a thyroid disorder. If you're taking any medications, it's important to talk to your doctor about their potential impact on your thyroid health. Iodine deficiency is another risk factor for thyroid problems, particularly in developing countries. Iodine is an essential mineral that's needed to produce thyroid hormones. And lastly, certain ethnic groups, such as Caucasians and Asians, have a higher prevalence of certain thyroid disorders. Now, if you suspect you might have a thyroid problem, the first and most important step is to consult with your healthcare provider. They can assess your symptoms, review your medical history, and order the appropriate tests to determine if your thyroid is functioning properly. One of the most common tests used to diagnose thyroid disorders is a blood test called a thyroid panel. This test measures the levels of various thyroid hormones in your blood, including TSH, T3, and T4. TSH, or thyroid-stimulating hormone, is produced by your pituitary gland, and it tells your thyroid how much thyroid hormone to produce. If your TSH levels are high, it could indicate that your thyroid isn't producing enough hormones, which is known as hypothyroidism. Conversely, low TSH levels could suggest an overactive thyroid, also called hyperthyroidism. T3 and T4 are the actual thyroid hormones that regulate your metabolism. Measuring their levels can help your doctor determine the severity of your thyroid imbalance. In addition to blood tests, your doctor may also recommend an ultrasound of your thyroid. This imaging test uses sound waves to create pictures of your thyroid gland, allowing your doctor to see its size, shape, and any nodules or growths that might be present. If nodules are detected on the ultrasound, your doctor may recommend a fine needle aspiration biopsy. This procedure involves using a very thin needle to extract a small sample of cells from the nodule. The cells are then examined under a microscope to determine if they are cancerous or benign. Once your doctor has made a diagnosis, they can work with you to develop an appropriate treatment plan. Treatment options will vary depending on the type of thyroid disorder you have, the severity of your condition, and your overall health status. While conventional medical treatments are often necessary to manage thyroid disorders, there are also several natural remedies that can help support thyroid function and improve your overall thyroid health. One of the most important things you can do is make sure you're getting enough iodine in your diet. Iodine is an essential mineral that's needed to produce thyroid hormones. Good sources of iodine include seafood, seaweed, dairy products, and iodized salt. Selenium is another key nutrient for thyroid health. It acts as an antioxidant, protecting your thyroid gland from damage caused by free radicals. Brazil nuts are one of the richest food sources of selenium, but you can also find it in seafood, meat, and poultry. Probiotics, which are beneficial bacteria that live in your gut, can also play a role in supporting thyroid health. They help to improve digestion and nutrient absorption, which is essential for optimal thyroid function. You can increase your probiotic intake by eating fermented foods like yogurt, kefir, and sauerkraut. Eating a diet rich in anti-inflammatory foods can also be beneficial for thyroid health. Inflammation can contribute to thyroid problems, so it's important to minimize your intake of processed foods, sugary drinks, and unhealthy fats. Instead, focus on eating whole, unprocessed foods like fruits, vegetables, lean proteins, and healthy fats. And lastly, regular exercise is crucial for maintaining a healthy weight, reducing stress, and improving overall thyroid function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And there you have it, a crash course on thyroid health. We've covered a lot of ground today, from the subtle symptoms of thyroid problems to the importance of early detection and the power of natural remedies. Remember, your thyroid plays a vital role in your overall well-being, so it's essential to prioritize its health. If you suspect you might have a thyroid issue, don't ignore the signs. Talk to your doctor, get tested, and take the necessary steps to manage your condition. While natural remedies can be incredibly helpful in supporting your thyroid, they're not a substitute for professional medical advice. Always consult with your healthcare provider before making any significant changes to your diet, lifestyle, or supplement regimen, especially if you have an existing thyroid condition or are taking medications. And as always, I encourage you to continue researching, asking questions, and advocating for your own health. Knowledge is power, and the more you know about your body and how to support it, the better equipped you'll be to live a long, healthy, and vibrant life. Thanks for joining me today on this deep dive into thyroid health. I hope you found this video informative and empowering. Remember, taking care of your thyroid is an investment in your overall well-being. If you enjoyed this video, don't forget to give it a big thumbs up and subscribe to the channel for more health and wellness tips. And be sure to share this video with your friends and family. You never know who might benefit from this information. Until next time, stay healthy and take care.